I just want to welcome you to our final session, Path in the Continuum of Care, the best of both worlds. I'm going to go ahead and pass it off to Sherri Downing. And Sherri, the floor is all yours.
Thanks, Tony. Oh my goodness, you have made it with us through the whole day. I'm so excited that you're back and excited to talk to you a little bit about the continuum of care. I have the great pleasure of getting to do some technical assistance and training with the HUD continuums of care. And actually, I'm working with Alaska right now, which is sort of exciting. Very, very rural, more rural than any place I've ever been in my life. But the continuums are a wonderful tool, and it's a wonderful engagement strategy at a community level. So we've really been kind of in the weeds today, talking about how do you engage with the folks we need to serve. This is really going to be more about how do we engage at a community and an agency level and even a state level to make sure that people have what they need, because there is no program that can provide everything anybody needs. We can't be the be all and end all. So this continuum of care was really a sort of cross-agency national effort to make sure that everybody across the many silos was speaking to each other. So I'm going to ask you throughout this presentation to kind of weigh in on how that's working out for you in your communities. And I want to hear more about each of your three continuums. So we'll start with, if you could put in the chat, which continuum are you in? It's just which continuum are you in? And are you personally through Path engaged or through whatever agency you're with today? So are you engaged in the continuum, and which continuum are you in? And I'm going to have the chat open so I can see what you say. But what is a continuum? Okay, we've got two balance of states. Balance of state is way ahead, you all. You may want to balance it. We've got three balance of states and an MCCOC, two more balance of states. We are in the lead. If this was a horse race, balance of state would be way ahead of all the others. MCOC and the balance of state. This horse race is not much of a race, you all. Balance of state. All right. I'm going to want you to talk to me a little bit about that. I live in Montana, which I may have mentioned or may not have mentioned, but we have one statewide continuum of care, and then there are little branches, and I think just 5 of our communities. But we are deeply rural, and in many cases, we're really the frontier. And so it's really hard to sort of employ a national model that was designed for an urban population. It's hard to employ that in a really rural, or in particular, a really frontier area. So I would love it if we could talk about that a little as we go through this. But what is a continuum? A continuum of care is really a regional or local planning body that coordinates housing and services for people experiencing homelessness. That sounds really simple, and it can be really complicated. And some of what complicates it is that we have been operating in funding silos forever, I think. And the funding silos can become very entrenched and can become very mindful of potential resource loss. And so this continuum of care strategy was really a national effort, or federal effort, to bring people together to talk about meeting the needs of a common population. And the reality is lots of people across the agencies, across the silos, across the systems are dealing with the same exact people: homelessness and serious mental illness, and state hospitals, and, as Michelle brought to your attention in the last session, police departments, sheriff's offices, as well as federally qualified health centers and primary care providers and treatment providers. And the list goes on and on and on. Even the churches can have a role in these continuums, but it's really an effort to bring churches or other faith communities, but it's really an effort to bring resources together around a common table so that we can plan and coordinate in a way that's going to really make a difference for people experiencing homelessness. So a COC, a continuum of care, really is charged with, this is what HUD asks us to do, is create a community plan to organize and deliver the housing and services. So there's a competition on an annual basis where the plan goes in for funding, and sometimes things are funded and sometimes not. I think it depends on the tier that you put it in your proposal. But the reality is the community plan to organize and deliver housing and services needs to be meaningful, and it needs to be robust. And it really needs to look at how can we come together to help and serve the people who are experiencing homelessness in our community or our region, or in our case, our state. So what they are designed to do, what continuums are designed to do, is bring together representatives from stakeholder organizations across the board. We want people around one table. We want them talking to each other and sharing resources and bringing to the table what they can to put into this plan, into this continuum, into this. And I love the word continuum because it really implies we're going from, all across the whole rainbow, from, red all the way to purple on the other end, in a way that makes a lot of sense for the people experiencing homelessness. Path is absolutely crucial to the continuums. And that's because you are really one of the few agencies, one of the few programs that has access to the population that the continuums are designed to serve. So a federally qualified health center may well have good access through healthcare for the homeless, but they aren't going to be doing street outreach. They're not going to be out under the bridges or in the encampments or in the alleys or behind dumpsters. I mean, all the places that you can find people trying to survive. Federally qualified health centers are going to be tied to their building. They're going to be tied to their agency. And I know that healthcare for the homeless does have some outreach workers, but they're not going to be specific to people who are struggling with serious mental illness or co-occurring disorders. So what we really want to do is bring people together, and PATH is really the common denominator. You guys are really a bridge, and a very significant and important bridge to the community of people experiencing homelessness. We want to see a wide range of folks and organizations included in these continuums, and it might be the community action agencies are a wonderful example of a collective body of resources under one roof. Victim services providers and local governments can serve a really important role. Even state government can provide a really important connection for the continuums. The continuums are all required to establish a board to act on its behalf, and the continuum may appoint additional committees. Most of them do. There are typically committees or work groups that fulfill the responsibilities of the continuum, and they're going to work on things like policy and protocol. They're going to work on how do we strategize to really make this work for our community. They're going to develop a governance charter to document all the groups created to support the continuum and every group's relative responsibilities. So this is a really robust, it is supposed to be and should be, and hopefully is a really robust effort to bring together resources in a planful and strategic way to serve folks who are experiencing homelessness. And Mandy, I know that you guys are really involved in the continuums, particularly the balance of state. but I think in the other ones too. Can you speak to the state's role just a tiny bit? And then I'm going to lean into you a minute later in a little bit in a few slides.
Yeah, absolutely. So in terms of the balance of state continuum of care, the Bureau of Housing Supports is the collaborative applicant for HUD, meaning we collect all of your project applications and all of the information throughout the year and put it into one giant application that goes to HUD that provides a lot of funding for some of the programs that you'll hear about throughout this presentation. Outside of that, we also are the state recipient for other funding streams, such as this SAMHSA's PATH program, as well as the Emergency Solutions Grant, which do not go through that COC application process. So as such, they are statewide. So that's why we have some folks from the Manchester COC, some from the Greater Nashua COC. So although we are lead only for the balance of state, we do work across COC lines for some of those other project types.
Thanks, Mandy. And you are, so what I'm hearing you say is that you really encourage PATH to be involved in a really, in a really meaningful way.
Oh, and we have some all-stars here in the room that definitely lead that charge for the COC. So you can certainly hear from them as the presentation goes as well.
Oh, I'm excited. So you may have to point people out for me, but I'm excited. I want to hear more about this because I know that my sense is that New Hampshire has quite a lot of rural area like we do here in Montana. And it's been an interesting challenge to implement this practice across, wide swatches of rural areas. So this will be interesting to talk about. So in the beginning, the U.S. Department of Housing and Urban Development established the COC program to, quote, promote community-wide commitment to the goal of ending homelessness. I know some of the people who were involved in brainstorming the Continuum strategy originally, and one of the TA providers that I've been following around like a puppy for years started this whole process with some scribbles on the back of a page. She's a great diagram creator, and then began talking about how this would look and had the ear of HUD because she was a TA provider for HUD and gradually pulled together a lot of the other agencies. This has been widely accepted across agencies. I would say Health and Human Services, Department of Education, Department of Labor, Department of, HUD, obviously. But people went, yes, this is a good idea. We should support this and we should be engaged in this. And what the Continuum process does, what HUD does, is provide funding to quickly rehouse people experiencing homelessness. Now, that's the goal. We want to quickly rehouse. So there are strategies to do that under HUD and under the continuums, like rapid rehousing. And we've got the emergency solutions grants, which are different, but certainly work in combination and collectively with the Continuum of Care grants. We want that to happen. We want all of these programs to come together in a way that will sort of leverage their impact across the board. And what the end result is, ending homelessness. Now, when I first started this work, I don't know, 150 years ago or something, people were like, we'll never end homelessness. Really, what are you talking about? But the reality is we know how to end homelessness. We do need the political will to do that. This becomes part of that political will, certainly. And you're not going to end people becoming homelessness for all the reasons that people become homeless. And we talked about that in one of the earlier sessions. What we can do is make sure that it's rare and brief. And that's really what the continuums strive to do. It needs to be rare and brief. And I think that that's part of the continuum language, is that we bring everybody together because everybody's going to have a piece of this important puzzle of ending homelessness. And so for one person, it might be substance use treatment. For another person, it might be mental health treatment. For somebody else, it might be assistance in leaving a domestic violence situation. The problems are going to vary, but the whole intent is to make sure that it's brief and rare and that people get back into housing and get on with their lives. Because homelessness, as we know, is a great disruptor of people's lives. So there are 5 components to the COC program. And all of these are funded under these COC grants. So it can be permanent housing, transitional housing, supportive services only. They also fund the Homeless Management Information System, or HMIS, that I know that you're all familiar with. And they also fund homelessness prevention. So these are sort of the collective pot of resources that HUD puts in to end homelessness, to make sure that it's rare and brief. And we are going to talk a little bit about each of these in context with what HUD says about each of these. So permanent housing in HUD speak is really, there's 2 types. So there's permanent supportive housing for people with disabilities, and permanent supportive housing I love, and I do a ton of work on permanent supportive housing across the country, working closely with Virginia right now on a really fun project. And what I love about this is there's a housing voucher available for folks who have a disability and who are homeless. And then people, once they're housed, are wrapped around with flexible voluntary services. Now that service package is going to look very different for every single person. That's the intent of permanent supportive housing. And that is sort of the gist of the SAMHSA model of permanent supportive housing, which is an evidence-based practice and one that really works. Corporation for Supportive Housing is one of the agencies at a national level that does a whole lot of work around permanent supportive housing. They don't exactly use the SAMHSA model, but it's very similar. And then Housing First is really very high fidelity permanent supportive housing. And that is another manualized evidence-based practice that really works. Now, those really focus on making sure that people have the components of the components they need to move on with their lives. So it's housing, and it's low threshold. It means that you don't have to get sober to get housed. You don't have to go to treatment to get housed. You don't have to, you don't have to really do anything except really need the housing. So I guess that means, you have to be human. The reality is, the services that are available through the community are the ones that you wrap around people. So it's going to look a little different for everybody. It might be a dentist. It might be helping get ID. It might be treatment of one sort or another. It might be the food bank, or SNAP, which is what we now call food stamps, but it might be all the different resources that people can get. It should come in and merge and meld with SOAR, SSI, SSDI, Outreach, Access, and Recovery, because that will help people get supplemental security income if they need it, if they're eligible for it, as well as health insurance through the Medicare program. So this is a really important evidence-based practice. I am also on the board of directors for the local housing authority, and we get permanent supportive housing vouchers every year for people who are experiencing homelessness, and it's wonderful. The way that it works through the housing authority isn't necessarily the way it would work through SAMHSA or even through, CSH or Housing First, because they have the housing. At the housing authority, we have the housing. We've got these vouchers for people experiencing homelessness, but the the mechanism to wrap services around people. And that is part of the practice, is that these are voluntary, flexible services. And people get a standard lease for the housing. The reality is that the support is only going to be as strong as the continuum of care. So you've got to have those supports. You need case management, you might need an ACT team, and you might need, you might need treatment, or you're going to need a whole variety of things. And it's really the way that this works with these permanent supportive housing vouchers through HUD to the public housing agencies is really only as strong as the continuum. So that connection is critical. The other kind of permanent housing supported by HUD is rapid rehousing, or RRH. And that is just really, that came up, oh gosh, 10 years ago. Somebody can correct me on that. I think that's about right. But it's really about getting people who become unhoused, housed again as quickly as possible. This is often used for families. This is often used for people who really are struggling, particularly with poverty, maybe not necessarily with disabilities, although they're certainly not precluded. But rapid rehousing is a device to get people back into housing as quickly as possible before they're destabilized. There's a wonderful book that was written several years ago, and it was called Evicted, I think. But it really followed families through the eviction process in a way that showed how destabilizing being evicted and trying to get right back into housing, or getting back into housing, can be. So people that were forced to leave their school systems, their kids are destabilized in school, and then there's school problems, or, they don't have the money to get right back into housing. So they might be forced to go to shelters for, an undeterminate period of time. That is the kind of thing that we're trying to avoid with rapid rehousing. So those are the two kinds of permanent housing, conceptualized and supported by HUD. The permanent housing is community-based. It just means you live in the community and the housing that's available. There's no designated length of stay. If you have a housing voucher, as long as you remain eligible for that voucher by income level, and make sure that you don't cross any lines that break your lease, you can stay there as long as you need to. It's independent living. So it's living like you have and I have, and probably most of us in this room have. So you have your own lease. It's a standard lease that you sign, and you pay your rent, which is typically 30% of your adjusted gross income, which is what HUD feels is affordable for people. So you meet the conditions of the lease, and you have to be, and you run your life. You fill your refrigerator, you put your clothes in the closet, you lock the door behind you, and you live your life. It's independent living. You need to be on the lease or sublease for an initial term of at least 1 year, and then it can be renewable for at least a month. It's a renewable resource as long as you're in there and you meet the criteria and you haven't broken the conditions of the lease. It's renewable, and you can only be you can only be terminated or evicted for cause. So that means you move people in who are not on the lease, and they're there for 2 months, or they're there for a month, and that is breaking the terms of the lease. It might be hoarding, or it might be using or making meth. That's a bad one. That will keep you out of HUD housing forever, I think. It might be any one of a number of things that breaks the lease, but you can only be terminated for cause once you get into this permanent housing. I'm going to look here to see, I see somebody has put a comment in. Angie Morgan. I know this is something that all of us who oversee housing vouchers, and our ultimate goal is to get our clients housed as soon as possible. But the fair market rents from HUD are 3 years behind and on average. In my catchment, it's taking anywhere from 3 months to a year to get someone housed due to an increase in rents and inflation. Is HUD going to catch up with rents? What rents are now? I think that's a wonderful question. And I do think that they're mindful of this. I think that they have absolutely been working and listening. So I don't know if you have anything more that you'd like to add to that. Angie, you're certainly welcome to come off mute if you want to. This
Hi,
is
Sherri.
hard. This is a problem across the country.
It most certainly is. And in my particular catchment, I do not have any shelters. So we're always referring out to the surrounding areas, catchments for shelters. I would say about 90 to 95% of my individuals or families do not want to go to shelters to begin with,
Right.
for various reasons, as we all know. But a 1-bedroom in my catchment alone is running anywhere between $1,800 to $2,500 just for a
Holy
1-bedroom.
cow.
And my
Holy,
FMR for a 1-bedroom is only $1,432. So it's taken us a significant amount of time to find something within the FMRs. Now I understand that I know I can do a rent reasonableness.
right.
However, you can only go so high, before you have to kind of pull back
Right.
with what the FMRs are. So I know this is across the board, not only a New Hampshire issue with HUD as far as what they feel is fair market rent, but also across the nation as well. So, it just looking at the pattern that I've been observing over the past 5.5 years of doing this, my observation is that they're literally about 3 years behind.
Yeah, I think you're right. And what we've seen, and I think this is a COVID kind of response, and I'd be interested to see what you think, Angie, but people are pouring into Montana and they're paying top dollar for places to live. Well, that's wonderful, but it pushes people out. And then, and then they buy what they can afford. And then that pushes people out. And pretty soon, there's the resources are exhausted and there's really no place to even go, particularly for the people we're serving. Is that what you're seeing?
Yeah, in fact, example is we had a client who we vouchered and we were all excited. We found an apartment, during COVID for them. We were all ready to sign a lease. This potential landlord called us up and said that he decided to rent to somebody else because they were willing to pay $800 more.
Wow. Yeah. And we're seeing that across the country. It's scary. We need more housing. There's no question about it. I think HUD is really mindful of this. And I know that they do the fair market rents on an annual basis. One thing I've seen some communities and some states do is an analysis of what rent is really costing and then submitting that to HUD. It's sort of a rent reasonableness strategy where they say, look, this is what it's really costing. We've done this study, but those studies are expensive and time consuming and complicated. So, it's a solution, but it certainly isn't the solution, especially for rural communities where everybody's already wearing 3 hats. So thank you. I hope you'll come back on in a bit. So that is permanent housing. Transitional housing really is providing a place for people to stay that's interim. So it's a bridge to permanent housing. It gives some interim stability and support. I can tell you, I'm not currently on that board, but I previously served on the board of our YWCA, and the whole intent of that agency here in my community was to provide housing for people who are coming out of homelessness. It's the YW, so it's women coming out of homelessness. Some have children, and they are people with a significant number of vulnerabilities, many coming out of prison or jail, many struggling with substance use issues or mental health issues, or just plain poverty or sometimes domestic violence if the domestic violence shelter is full. But when we first started really working with this population, when it became a real problem in our community, we had to really stop and think, how are we going to bridge people into housing? Because what transitional housing used to sort of do was oh, here, you can come here, but you can only stay for, 6 months and then you've got to be on your way. Well, if there's no place to be on your way to, it can be an endless cycle between housed and homeless, between transitional housing in the streets, between transitional housing and, and back to jail or shelters or any number of places that we know people cycle through when they are experiencing homelessness. Transitional housing, it can be a good stopgap measure. It's not the be all and end all, but I do think it's one of the pieces of the puzzle, and it can cover the costs of up to 24 months of housing with supportive services. So you're wrapping around somebody, you're really making an effort to get people what they need to get on with their lives. For transitional housing, you do need a lease or sublease, or at least an occupancy agreement in place. And I think HUD has been funding somewhat less of this because this isn't the optimum. Because transitional housing by its very definition is temporary. We don't want people in temporary housing. It keeps them destabilized. And it is, that's difficult. It's hard to be worried about where you'll be at the end of the 24 months if you don't, particularly if you're living in a community like Angie just talked about, where there just really isn't housing. And that's many communities across the country right now, where it is just darn difficult to find housing. Another program component for the COCs is supportive services only, and that one allows recipients and subrecipients of HUD funding to provide services to people experiencing homelessness or families experiencing homelessness, not residing in housing operated by the recipient. So you don't have to be operating the housing, you can still provide the services. You can use these funds even to conduct outreach to people who are sheltered or unsheltered, link people with housing or other services, and provide ongoing supports. So it's some of the stuff that people need to begin moving toward housing. SSO projects may be offered in a structure or structures at one central site. SSOs, supportive services only, that one always throws me. So I just thought I'd say that. But they can be offered in a structure or structures at one central site or in multiple buildings or scattered sites where services are delivered. And the projects can be operated independent of a building, like street outreach. Now, I haven't seen a ton of, services only COC projects that are doing street outreach. But I'm going to ask you all, have you seen that? Are you seeing that in your communities where SSO component, the SSO component of COC programs are used for outreach?
So the balance of state, we have coordinated entry SSO. So a part of that can be used for street outreach. We're really hoping for the supplemental NOFO though, because there were a lot of applications for SSO outreach, which would really help our community response. So fingers and toes crossed, everyone, that we get those funds. Probably won't hear until next summer, but.
It's going to be hard to write or type, but we will do it for you, Mandy. Keep our fingers crossed, because this is important. PATH is a relatively small niche program, and we, to get additional street outreach would be phenomenal for the people that we serve. But SSO projects can be provided in a range of community-based settings, including homeless programs operated by other agencies. So this is a really nice option. I'm happy that HUD has, has included that in this package of services that fall under the COCs, because it's important. This is part of the glue that holds families and individuals together. Also, the Homeless Management Information System, or HMIS. These funds can be used by HMIS leads, and every continuum has an HMIS lead. And it can be used for leasing a structure where the HMIS operates, or costs to establish, operate, or customize the HMIS. Others may not apply for funds under this program component except the lead agency, but they can include costs associated with contributing data under another program component. So if you've got a permanent housing or a transitional housing or even an SOS project, you still need to participate in HMIS and contribute data. And so some of that expense can be contributed. And Mandy, I don't know who is in here who is, really deep and wide in the HMIS, but I know Michelle Baxter is really good at this, but is there somebody from New Hampshire who's HMIS?
So luckily we have one vendor for the whole state, all 3 COCs, which is a relief. The Institute for Community Alliances. They were in the first session for Path 101, but I think they had to jump off. But yes, they are wonderful. They're accessible. So they're our go-tos for HMIS.
Oh, that's fabulous. Yeah, I heard them speaking during the one-on-one project. Does anybody, HMIS has always been sort of a, people kind of grouse about it, HMIS, but really it's to our benefit to gather this data. I don't know if you have anything you'd like to add to that, Michelle. This is important, and it's data collection, and and a lot of people shy away from that, particularly if what they come in for is outreach and engagement and working with the people. But this is important. So I will just, Michelle, if you have something you'd like to add, this would be a great time.
About the only thing I'd add, we've expressed the importance, and Mandy's HMIS leads are incredible. I was doing backflips in the Path 101 session when they were talking. The other thing to consider with the HUD HMIS programs is that the HUD Continuums of Care are the entity which choose the HMIS product that is used within that COC's territory. And each COC within a state could, while it doesn't exist that way in Mandy's state in New Hampshire, it could theoretically be different for each COC. So New Hampshire is very lucky with how their HMIS is being run and how they are looking at funding. But as far as people taking advantage of these funds, absolutely. Each state can run it slightly differently. When I was SPC in Pennsylvania, we did hold back some of the PATH funds that were allocated to us from the federal government to use toward the balance of state HMIS system, whereas the proprietary areas paid for their own. So it depends on each person's situation and each state situation, and it can be held very differently. But if there are funds available to take advantage of it, the more money you have for HMIS, the more you can specialize or augment the actual software to do what you need to do for you and to make specialized reports that might be beneficial to your state or your territories. So absolutely, if you can and you have a right to do it, I would apply for any funding you can get.
Thank
We
you.
actually
Well,
just switched platforms based on some of the feedback of our previous platforms. So actually there are PATH providers that are on the HMIS advisory committee that were a part of that, giving feedback about what's important for outreach. And then that was reflected in the choice of the new platform.
Fantastic.
That is wonderful. I think PATH is required to use HMIS, or in SAMHSA lexicon, strongly encouraged. But I will say this is important for the PATH programs and for the continuums of care. This gives us a more robust and accurate picture of the people we're really connecting with who are experiencing homelessness than the point in time, which is not a census by any stretch of the imagination, but just the number of people we can locate on a given day in January. So, this can be customized and needs to be to give us the information that SAMHSA requires from HMIS, which then goes into the PATH data exchange or PDX system. Michelle, I don't know if you have anything more you'd like to add to that or not. Okay, well, but thank you. I do think this is important. A lot of people sort of view it as, a necessary evil, but it is a necessary evil because this is what HUD and and our legislature depends on to determine, is this really needed? Really, do we have homelessness? Yes, indeed. And we can prove that through our HMIS data. The other component of the COCs is homelessness prevention. And so recipients and subrecipients located in high performing communities can use COC funds for homelessness prevention assistance for people who are at risk of homelessness. And this is a nice connection with PATH, because PATH can also work with people who are at imminent risk of homelessness. So this is a good addition to the package of HUD COC offerings. And the services that can be offered under this one are housing relocation or stabilization services. Now, once somebody gets into housing, if they're evicted, then it becomes a huge, huge problem. If you're dealing with somebody in poverty who has serious mental illness or co-occurring disorders, and they finally get into housing, and then for one reason or another, they are evicted, then you've got to come up with another security deposit. You've got to come up with rent again. You may have to clear up money that you owe to the housing authority or to power providers. So, it's once you're destabilized to that point, it can turn into a domino effect where all the dominoes just start to fall, because how do you ever get back on your feet at that point? So being able to provide these services that include housing relocation, picking up the suitcases, picking up the little bit of furniture and moving it to a different location, or just paying the back utility bill and getting people back on their feet financially through stabilization is a huge gift to this effort that we make through PATH. So what do COCs do? I mean, you have meetings and you make a plan, but what do you really do? So you track and manage the local homeless community, and that's partly through HMIS. You are charged with holding the biannual point in time count. It was annual. It lately, I think this year it needs to be, I think people need to get out and count in the streets again, although that was sort of, they got a little bit soft on that during COVID, which was absolutely important. But this point in time count is really important just to show what you are able to look at during, this one point in time on the calendar. This year, I think it's January 27th. And then you also, during this period of time, you also enumerate the emergency systems, transitional housing units, and beds that make up the homeless assistance systems. So emergency beds, transitional beds, emergency. And so the point in time count really provides an overview of the state of homelessness in any COC and offers information needed to redirect services, funding, and resources if needed. COCs also manage services and often offer prevention strategies and homeless assistance programs to help those at risk of or experiencing homelessness. So that's really what is a continuum of care. And I would encourage you to look at this National Alliance to End Homelessness resource if you want more information. The COC program promotes community-wide commitment to ending homelessness and provides funding for nonprofit providers and state and local governments to quickly rehouse homeless individuals and families. And that is, in quotes, that is HUD language. We typically in PATH go for person first language. So this would be reframed as quickly rehouse people and families, or individuals and families experiencing homelessness. Either way, this is a really wonderful and valuable program. And grants are offered through a competitive process And the legal authority is Subtitle C of Title 4 of the McKinney-Vento Homelessness Assistance Act. So more information is available through HUD, and this is a hot link when you get these slides. I would encourage you to take a peek at that if you haven't. New Hampshire COCs, and I would love you guys to come offline and talk a little bit about how this is working. But communities work across systems to end homelessness. I think we've established that. And we want to make it rare, brief, and non-recurring because we come together to align funds and programs and services and housing options. And what we're really doing with that is creating systems that better meet the needs of the folks we serve. And that work is facilitated by HUD COC program. And what the COC program does is assist individuals and families experiencing homelessness and provides the services needed to help such individuals move into transitional and permanent housing with the goal of long-term stability. And there we have it again in quotes. That's coming right out of the COC program eligibility requirements. But I think the goal of promoting long-term stability is absolutely critical. You all have 3 COCs. The balance of state is really well represented based on the chat. And then you've also got Manchester COC and the Nashua Hillsborough COC. So who is here? We've got several people here from the balance of state. Is anybody willing to speak a little bit about how that's working for you?
I'll put your muffs on.
It's hard. It is hard. I will say here in Montana, and I will speak for Montana for better or worse. This has been a difficult practice just because we're so big and so unpopulated. So the COC money ends up in, I think, five of our biggest communities. And a lot of the real balance of state really never sees the benefit or does accounts or justifies the need. So what are you seeing in New Hampshire with balance of state? I'm sure you're more populated than Montana's balance of state.
I think it's interesting for balance of state because the North Country doesn't look like the Seacoast, doesn't look like the Keene region. So when we do have balance of state meetings, we always love hearing from providers because the same intervention may look very different, region to region. So we have some providers here like Tri-County, they cover the northern 3 counties in the state. So that's a lot of geography, it's a lot of land and some of the most rural land we have. So
absolutely. And the COC, the way it was originally conceptualized, it was an urban centric model. So you could find anything you needed in a 12-block radius, right? So, you're going to find treatment providers and housing providers and shelters and maybe even the Social Security office. Everything's going to be sort of tightly packed. But in a rural area like, rural New Hampshire, rural Montana, it can be we call it windshield time here. There can be hours of windshield time between services, honestly, or clients even. So what are you seeing? What are you seeing there, balance of state? And then I'm going to pick on Manchester and then Nashua Hillsborough.
Hello, Miss Sherri. How are you?
Hello, I am well. Thank you so much for coming on.
Yes. So what we're seeing up here in Coas in Berlin, just like Angie Moore said, is, rent is increasing.
Yeah.
And we don't have a lot of landlords.
Right.
We do have a lot of homelessness, that we're trying to provide here. But how can we provide and give them, housing when rent is high and landlords don't want to, drop rent down?
Right. Oh, yeah. No, those landlords do not want to drop the rent down.
No.
Is it Janae? Am I saying
It is
name?
Janae, ma'am.
Thank you, ma'am. I really do appreciate you talking. Do you see, I mean, is homelessness obvious in your area? Do you see it?
Yes, 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 it is. And we're, like I said, we're getting more calls now because what's going on in the town of Berlin.
Right.
So, we're trying our best. We're trying to get out there, but landlords are not trying to bring rent down because like you said, like COVID, when COVID hit, ma'am, that's when everything started skyrocketing. And then with the politics coming in to the state, that's a whole different, different thing. So we're trying, we're doing our best, and, we're here for the people.
Absolutely. Thank you for sharing. I appreciate that. And you're doing wonderful work. This is hard stuff. So
Yes.
I appreciate that.
Thank you.
Anybody else want to say anything about Balance Estate? I'm going to move on to Manchester. Manchester, come online. Well, how is it going? How is the COC working for you? What does it look like that is a little bit different? And it looks like you're the smallest little COC, the little blue box down next to the sort of red outline.
We're the smallest in the area, maybe, but
But not the smallest in population is my guess.
largest city.
Yeah.
This is the largest city in New Hampshire. We are seeing, we were seeing lots of rent increases before the pandemic happened.
Mhm.
And we were seeing our numbers go up as a result. And then the pandemic just kind of exacerbated everything.
Yeah.
So, all the same problems, just kind of in a little bit more of an urban setting, I think.
Absolutely.
It's we have one shelter for adults that has 138 beds, and it's full.
That's a big shelter.
And it's full every night. It was through the summer. If they had 10 beds open, that was a good night.
Wow.
We have far more homeless people than that. So even if everybody came to our outreach and said we want a shelter bed, we couldn't get one for them.
Yeah.
So, then we have one family shelter that has 11 rooms for 11, so they can fit 11 families in it. And if it's a family that's too large, they can't fit in there, because I know that's an issue right now. And the Continuum is working. We're working the best that we can to navigate all this stuff, but it's not easy. For sure.
Oh gosh, no. I would say nobody in the whole universe is going to say this is easy.
Yeah.
But are you guys, is Path really engaged with the Continuum? Are you guys in the middle of it, knee deep?
Yeah, we are definitely. I'm on the leadership committee of it, and I chair a couple of committees.
I'd say you're knee deep. You may be shoulder deep, sir.
Matt is very humble indeed. Yes.
Yeah,
the joke is always that at least we have Matt, right? So for so long it was, well,
oh, that's funny.
So, yeah. It's great to see that more of your team here, that it's expanded, but for many years it was that.
Yeah, and before me it was Dave Carroll, who's back on my team as well.
Oh, nice.
He did a lot as well. But we participate pretty well with the Continuum. We collaborate with all the other agencies as much as we can, and especially the other outreach agencies. We try to do some outreach together, and just so we have a wide variety of services that we can offer people when we are out in camps. So I think our relationship with the Continuum Care has been pretty good.
Is it working like it should? I mean, we've talked about sort of the theory behind the Continuum. So is it working?
I think in some ways it is. I think it's allowed us to collaborate a lot more than we probably would have without it. And the pandemic actually is that we're collaborating even more than we ever had before.
That's excellent.
Through the pandemic. As far as what's getting funded and things like that, it's like the Continuum, there's not enough money that comes in through is what the big problem.
Right. Always the problem.
I think that's the problem everywhere. So
yeah. Thank you, Matt. I appreciate this. I appreciate you coming on camera with me. Is there anybody from Nashua or Hillsborough who would like to say anything about how it's working there? It looks like you're the second smallest continuum.
So Greater Nashua, we have one subrecipient there for PATH, and Susan was on earlier, but she got called away, so they're not there. But yes, Nashua is one city, the city of Nashua, and then 9 towns around it. So they are their own separate continuum, but they do align with the Manchester and the Balance of State COCs for things like the Coordinated Entry Manual, HMIS vendor, of course, and then there's increased efforts to coordinate among the 3 for, all of those kinds of things, getting away from the siloing. Since someone could literally walk to all 3 COCs within a day. So.
Wow. Okay. That's amazing. Okay. Thanks, Mandy. I appreciate you coming on and talking about this. And so it sounds like it's working the way it essentially is intended to as well. But it's not the be all end all either. So I'm going to move us on. So 9 of your counties compose the Balance of State. The Bureau of Housing Supports is the collaborative applicant, which Mandy already shared. I think this is just a repeat of what we've been talking about, but the COC's funding serves homeless populations through permanent supportive housing, transitional housing, rapid rehousing, supportive services, and HMIS. And funding is accessed through an annual application process. And the state also funds homeless services and oversees administration of the PATH program, as well as, you guys have a youth homelessness demonstration program. Good for you. Those are neat.
They are a lot of work. I'm very thankful to not be the lead on that. That's one of my other coworkers, but yes, ourselves and actually Manchester were awarded them the same year. So yes.
That's exciting. Those are really neat projects. We got to do some work with those through the Homeless and Housing Resource Network that SAMHSA had a few years ago. And then, housing opportunities for persons with AIDS. These are all pieces of the puzzle. And I think what the greatest value of the COC is it brings the pieces together. I'm not going to read, I've got 3 slides that kind of cover what I found online about the the 3 COCs. And Mandy, I don't know if there's anything in particular here about Nashua that you want to pull out. But it looks like, they're trying their best to do what they can and should. And it looks like you've got a good range of folks, including faith-based organizations and veteran service agencies and welfare and educational institutions and youth organizations, as well as governmental agencies. So it looks like you've done a good job pulling it together, Nashua COC. And this is because this really is the range of folks that you want at the table. Even I will say we've even got a program here that pulls the churches together around people who are really just poor, but they don't have any really difficult issues. It's Family Promise. So there are family promises all over the country, but it gives families experiencing homelessness a place to stay while they get it figured out. And they stay in one church for a week and move on Sunday and stay in another church for a week. And during the week, they're hosted by a church. The church provides all the, food and social engagement and pro-social opportunities for this family. And there's a place to go during the day where people can get help filling out job applications or creating resumes. That is one piece of it as well. It doesn't necessarily apply well to PATH, but it's one piece of the puzzle because homelessness isn't just folks with serious mental illness and co-occurring substance use disorders. It's families and it's people who are just deeply in poverty or people who've had huge medical bills and couldn't cover them and ended up going into bankruptcy and homelessness. So all of these pieces come together under the umbrella of COCs. This speaks to the Manchester COC. Manchester, Matt, do you want to add anything to this? I just pulled it off your website.
No, we do have a good mix of agencies and some faith-based places.
That's
and
wonderful.
services and all that as well. I don't think we have it listed on our website, but we do have a lot of representation from a lot of different types of agencies. So.
Absolutely. And you never know who you're going to run into when you're doing outreach. And it may be somebody who's absolutely not a good fit for PATH, but they may be a perfect fit for Family Promise or the domestic violence shelter or one of the many others. So thank you. I put you on the spot. I hope you'll forgive me. And then to find your COC, this is just a screenshot of how to get there. And it gives you a link to get to the place on HUD, which can be sort of hard to find. And then click on contact a COC. And then you can go, there's a hot link, contact a COC, and it'll give you all the information that you need to get in touch with your COC. Hopefully you're already engaged. And I'm going to look, it looks like we've got some new messages. I love this. Nashua has a Family Promise, and I believe they oversee 21 families under one roof and are looking possibly in Western Rockingham County. Hopefully that is very cool. Good for them. Thanks, Angie. The COC really has two purposes, and I think we've really talked about those. I was worried that we wouldn't have enough to fill our hour and 15 minutes, but it looks like we're doing fine, you all. I think the COC application is designed to demonstrate broad community participation and identify resources and gaps in the approach to addressing homelessness. It includes action steps to end homelessness and prevent a return, and establishes local funding priorities. So each of these plans really should be very specific to the community that it will serve. Programs funded through the COC can only serve people who meet HUD's definition of homelessness. And it includes assisting people, including unaccompanied youth. And the aim is to help people move into more stable, either transitional or permanent housing. Eligible provider applicants include nonprofit organizations, state and local governments, public housing authorities. For-profit entities not eligible, but they can't be subrecipients or recipients of these grant funds. And eligible applicants have to be designated by the COC to submit an application. So this is really a very proscriptive process. And so you really need to be at the table to participate. The Safe Haven program, I'm not even going to go into this. These are no longer eligible under the COC program. If this is of interest to you, you can certainly go to the hot link at the bottom of this slide. But these can be, there's no new safe havens, there's no new SRO projects. But I will say the ones that were in existence can continue to be used. So the eligible costs vary by program component, and not all costs are eligible in every program component. HMIS is eligible under all, and acquisition of real property is eligible under permanent and transitional housing and supportive services only projects. What I would say about this, and probably a couple more of the slides coming up, is this gets complicated in a hurry, and HUD is sort of a labyrinth. And I would encourage you to go to the horse's mouth for a lot of the information about what's eligible and non-eligible, and exactly who can be served. But this is really all designed to address the needs of people experiencing homelessness. This is more about eligible costs, and that can be rehab is eligible under permanent, transitional, and supportive services only components. New construction is also eligible, but only under permanent and transitional housing components. This and the projects must demonstrate that construction is more cost effective than rehab. So this gets complicated in a hurry, and HUD really has its own way of doing things. The good news is there is funding available. There is funding available, and it's big money if you look at the money that pours into each state for these purposes. Rental assistance is eligible under permanent and transitional. It can be tenant, sponsor, or project-based. Leasing costs are eligible, but rents have to be reasonable. And then we get into that whole conversation we started earlier, I believe, with Angie. So, and here are some of the eligible activities. Operating costs, HMIS, and project admin are all eligible. You also need to keep them within the boundaries that PATH set, or that HUD sets for them. These are all of the many people who could and should be in the COCs. And I think, it's even interesting that we have hospitals and universities and law enforcement and advocates and victim services providers. This is everybody who are touching the population we serve. And I would encourage you, if you are working within the framework of your COC, to reach out to anybody you can think of. This is important, and it's important to have as many services and providers at the table as we can. I just want to underline something I said at the very beginning. Your clients are the perfect fit for the COC, and you have the opportunity to connect people experiencing homelessness with the COC. This is really valuable to the COC, and it's really valuable to PATH and to your clients. There's 7 active PATH program sites in the New Hampshire area, and I am using a map that Mandy provided. So you've got it in, I know that you all are aware, Tri-County Community Action Program, Riverbend. I am not even going to try to say that.
Monadnock.
Thank you. I'm still not even going to try. Greater Nashua Mental Health Center of Greater Manchester, Seacoast Mental Health Center, and Center for Life Management. So you've done a great job, Mandy, getting these really distributed through your state. It doesn't look like there are too many areas that are not covered at the moment. So nice job.
I will say number 9, which you can't really see on my map, but the blue, light blue is not, they do not have PATH. So if we could get more PATH funds, we could cover the entire state. But as of now, this is where PATH is. And in many of these areas, as you all know, that some of them are part-time staff providers as well, just because the funding is so limited.
Right. I want to just spend we've only got 5 or 7 minutes left, but I just want to talk about coordinated entry because it's really important. Coordinated entry really is designed to make allocating assistance effective and easy, no matter where or how people present. So what I always picture it as is a great big building with many, many doors. And it's like a no wrong door system, where people can walk in any one of those many doors and find what they need, because these are all going to be, everybody within that big building is going to be a member of the coordinated entry system. I have seen this work really well. I was in Houston where somebody who had been homeless, it was a woman who had been homeless for years, walked in and left with a house key. It was the most amazing thing I ever saw. And this is a woman who had been, it was amazing. This was a woman who had been standing in the rain. It was pouring down rain that day. She comes in and she gets dry and she just looks hopeless. And they're like, we think we can get you into a unit. We think we can guarantee you a house key. I doubt if she got actually into the house that day because there's some hoops to jump through, but it was amazing. And she was so heartened. The coordinated entry is important and it works because what you're essentially doing is a person-centered system that provides fair and equal access. It looks at prioritizing the people with the greatest needs, and it has really low barriers. So it's designed to screen people in rather than screen people out. And so a lot of the clients that you serve are going to be absolutely perfect for coordinated entry because they are going to have the highest barriers. And that's who this is for. It has a housing first orientation, which just means people get housed without preconditions and service participation requirements. If you're human, you deserve housing, you can get in. And that is a big deal. Mandy, do you have anything you want to add about coordinated entry in your area?
Oh, coordinated entry. It is an ongoing topic, ever evolving. Certainly there are subcommittees on it and, ongoing dialogue. So certainly
Thank
this
you.
snapshot
It's
is a
hard.
very brief summary
It's
of
hard.
it. So, yes.
But, essentially what it does, it's a process that includes a way to access housing and services at all hours. And there's standardized assessment. Oftentimes people use the VI SPDAT. It includes all the subpopulations, but it really is written in a way that people sleeping on the streets, people who are street homeless, who are living in places not meant for human habitation are prioritized. So the people are our people, I'm going to say our people, but the people PATH serves are often the most vulnerable in any community, right? They're seriously mentally ill. They're literally and physically homeless. They may be struggling with substance use disorders. They are deeply vulnerable. And instead of being the people, because they're also hard to serve, this is a difficult population to serve. And I think we've made that point today. Instead of pushing them out and taking the easier folks, like some programs do and some programs should. I think the Family Promise is a good example of sort of taking the easier people. We do the harder people, and that's who coordinated entry is designed to serve. So anything you can do to promote this is, to the benefit of our population. These are qualities of an effective coordinated entry. Uses HMIS, provides full coverage of the service population or the geographic area served, leverages local capacity, but this is all consistent with everything we've talked about with the COC. The cool thing with coordinated entry is that clients have to make fewer calls, have fewer screenings, fill out fewer papers, do not have to keep repeating their stories because this brings them into the great big building with many doors, and it's a sort of one-stop shop. Next steps, I would encourage you to, it sounds like you're all deeply aware of where your COC is, but if you're not engaged at this point, I would encourage you to engage. It is important. And then I will just close with one of my very favorite sayings. Home isn't where you're from, it's where you find light when all grows dark. And I really do think the coordinated entry and the continuums of care are really the place where we can all find light when it all goes dark. I will say that's it, folks. Thank you. Thank you for bearing with me. Thank you for bearing with all of us all day long. I'm handing it back to Mandy at this point.
We have a half an hour left. I can promise you I'm not going to talk for half an hour. I'm going to talk for about 30 seconds. I want to thank you all for being here. It's a lot of content that we went through today, but everything is recorded. We will get the content back out to you all. There is a survey to follow, so I would please request that you take the survey so that we know how to steer the ship from here, what you're interested in, what worked, what you'd like to see in the future. I want to say a huge thank you to Advocates for Human Potential for being here and sharing your expertise. And I think that's about all I have to say. I know it's been a long day, but I think it's a good day. And thank you all for the work you do every single day for New Hampshire residents.